Thank you for giving me the chance to speak today. And thank you to Stuart, Philippa and Michael for those excellent presentations before me. Now, some of this will be a bit of repetition to what you've heard before in those past two presentations, but I would also echo Michael's comments that, you know, the HSST experience is individual, and so we all approach it in different ways. So a little bit about me. I was a biomedical scientist. In fact, I still am a biomedical scientist. I maintain dual registration. I'm very proud to call myself a biomedical scientist and a clinical scientist as well. And I was a biomedical scientist for a long time. You know, it took up a large proportion of my lifetime, from 2003 to 2014. In 2014, the opportunity came up to apply for the HSST course. And in order to do that at the time, because I was a biomedical scientist, I had to go through an internal interview process because I'm an in-service trainee, and also a National School of Healthcare Science benchmarking process. But in order to start, I also had to claim equivalence as a clinical scientist. So I was successful in those interviews and in my equivalence portfolio, as well as my equivalence interview, and I gained state registration as a clinical scientist. So I was able to start work start HSST, should I say, in January of 2015. Now, this is where I work on the right-hand side. I work in Bristol for NHS Blood and Transplant, and my office is one of those little black windows there, just to the right of the blue sign in the big white building there. And it's a lovely place to work. It's a really, really good employer, and you know, it's a modern building. It's the biggest blood processing centre in Europe, and the facilities are fantastic. And you know, I really enjoy what I do. So, you know, when I began the HSST journey, I was one of the first students and the first scientists to begin the HSST journey in cohort 1, and I took the life sciences route, studying a pathway called clinical and laboratory transfusion. Now, obviously, I started that in January 2015, and I completed that route in September 2020. And after finishing and submitting my thesis, that was when I submitted my thesis and had my viva in September 2020. There was then an administrative process in order to exit the HSST program, and I did that in the early part of 2021. And I was employed 4 months ago now as a consultant clinical scientist, which for me is something that I never thought would happen, considering my career path. You know, starting off as a paper boy, I've had a variety of careers, from pot washer to profiterole filler to bank cashier, before I finally fell into my niche of science and worked my way up within the blood service, from trainee biomedical scientist to actually consultant clinical scientist now. But that has taken a long time, having gone to university in 1998 after failing my A-levels and doing an extra year in order to enroll on a biomedical science degree, and then obviously working from 2003, undertaking a master's, and then the HSST program. So, you know, it's a long journey, but throughout that journey, you grow as an individual, and I feel that I've grown, and all of that adversity that I've encountered throughout that and the failure has made me into a better consultant clinical scientist, who is able to support people who are perhaps struggling, and empathise with those people as well, because it's not all plain sailing, as I'll come on to later. Now, why did I do HSST? Well, the main reason I did it was career development. You know, it was offered, the opportunity was offered to interview for the HSST post within my organisation, NHS Blood and Transplant. And at that stage, I was a laboratory manager within a very specialised laboratory called the International Blood Group Reference Lab, where we identify new blood groups and identify rare blood groups, people with antibodies that make them very difficult to transfuse, and they may be transfusion dependent. But having undertaken a master's course, it had opened my eyes to the wider transfusion specialism and all of the things that go on, and really piqued my curiosity. So when this opportunity came up to learn more about my specialism of transfusion, I grabbed it with both hands. It's provided me a fantastic opportunity to network both inside and outside my organisation, liaising with people who are undertaking HSST different disciplines, but also on placement as well. Early on in the programme, when I would go on placement to hospitals and obviously go to meetings and meet different people who were doing different things within transfusion, be it transfusion practitioners, consultant hematologists, biomedical scientists, or medical laboratory assistants, or trainee biomedical scientists working in different fields and different laboratories within transfusion. It enabled me to have conversations and learn a lot about the whole discipline rather than what I was doing before. It's a fantastic opportunity, with the doctoral qualification as well as FRC path and the leadership qualification. You're never going to get an opportunity like this again. So for me, it was a no-brainer. It was something that I really, I love what I do. I love transfusion, and this was the ideal way of taking that to the nth degree. And as well, it was fully funded. So yeah, I mean, it was brilliant. It's fantastic, and I felt that it would enable me the time and the opportunity to develop both professionally to gain the qualifications of a doctorate and FRC path, and also personally as well to really push myself outside of my comfort zone. So what went well? Well, I said before that my employer, NHSBT, has been really supportive throughout the programme, and that was because it was new. Okay, I was cohort 1 of a brand new doctoral programme. No one has been a consultant clinical scientist within red cell immunohematology, which is what my kind of specialist area within transfusion. So it was all completely new. So I was allowed the flexibility to essentially explore using the curriculum and to kind of discuss with my employer, my educational and my clinical supervisor, what my training looked like. And that's really important for HSSTs, whether there's a defined job role there or not. Have that constant communication between yourselves as an employing organisation, but also what does the defined role look like? What does that training plan look like? And regular review, as both Philippa and Michael have said, is really important to establish what that eventual consultant clinical scientist post looks like. I had engagement of all my colleagues at work, and I work with a wide variety of people who are either medical or scientific, and also senior leaders within this organisation, to kind of both highlight to them what HSST was about and what the eventual outcomes were, but also so that if they had any ideas as to, okay, well, you should come to this governance meeting, or you should come and observe this meeting, or it'd be really good if you came to this laboratory to see this aspect of work. It provided me with a really broad experience of how the organisation works. And I think that, as the other presenters have said, having those experiences and being open to experiences and things that will open your eyes to how your organisation works within the wider NHS, it is something that HSST, one of the aims of HSST, and something as a consultant clinical scientist you should be able to understand. I would say that take the opportunities that come up. I've had lots of opportunities throughout my training in terms of lecturing and teaching different people as well. I lead an MSc module, so I get to lecture on that MSc. We get to liaise with colleagues to set the subject matter on that MSc through the University of Bristol, so through the University of West of England now, and also teaching not just medics as well, but teaching scientists, and also teaching members of the public, because different people with different levels of knowledge ask different questions. And as a trainee, HSST or consultant clinical scientist, being asked questions from different groups of people with different understandings of your subject area will really highlight gaps in your knowledge, because if you can explain a complex thing to somebody with no jargon, no terminology, then you really understand your subject area. And actually, they're often the people that will ask the hardest questions. So it is really surprising To me anyway, that was surprising, but you know, a really useful experience is teaching, and I would highly recommend trainees get involved with teaching different cohorts of people, their area of specialty, to really underline that training as well. And it also fulfills a really good science communication piece as well within your portfolio. You can link it to your competencies on OneFile. The HSST program gave me, obviously the opportunity to network with other scientists in other disciplines, obviously microbiology, genomics, histocompatibility and immunogenetics, and some other people working in Public Health England. It's given me a fantastic opportunity to build relationships with these people and understand ways that they do things that are applicable to our organisation, and actually are there ways that they work that could be translated to our organisation? Could we use some of those tools or some of those ways of working within our organisation to streamline our processes as well? I've been involved in writing guidelines, undertaking clinical audit, writing case reports, speaking at conferences. So all of these things are things that you should be considering as you move through the training pathway. There's interesting case reports that you would like to present at a conference, write an abstract, publish it in your scientific journal, so transfusion or transfusion medicine for myself being the main two. Some of those studies that I've published have gone on to influence guidelines, and I've also been involved in BSH guideline revision as I've come out in the later years of the course, in years 4 and 5 as I've gone on. And initially that was quite daunting, but it's been a really supportive process. It's been a really enjoyable process, meeting other colleagues throughout the profession. But it hasn't all been plain sailing. For me, as cohort 1, when I started, we had to do the clinical scientist equivalence process, which is no longer necessary if you're a biomedical scientist, and which is fantastic news through collaborative work between the Institute of Biomedical Science, the School of Healthcare Science, the Royal College of Pathologists, and the Academy of Healthcare Science. We've managed to remove that barrier for senior biomedical scientists with equivalent qualification. It's fantastic. For me, it was a new skill set. I worked in a laboratory, as I've said, which with some fantastic colleagues in a very specialist area, but there was a lot to learn. There was a lot to learn about the clinical side of transfusion. There was 2 on-call rotas to do, providing advice to doctors, and also speaking to patients sometimes, speaking to donors. There was a lot of new exposure to things that I wasn't familiar with, but it was a massive learning process, which HSST should be. The job was new. In order to, if your consultant post is new within your specialism, you really have to have a defined vision of what that end consultant post would look like. Okay. Now, for me, I also had a late start date, but obviously the school have been great in because of COVID and because of it was the first year that it was set up. The National School and Mays have been fantastic and very flexible because of the challenges that have been presented, and Philippa have described all of those things. So if you are encountering difficulties, then obviously do approach the National School. And again, there was no RCPAP examination when I started, and so there were delays in sitting the RCPAP because one didn't exist, and therefore what was the expectation of me in RCPAP? So I was the first person to sit the RCPAP in transfusion science, which was scary but exciting at the same time. And fortunately, I passed both my part 1 and my part 2. But again, after a lot of study of the discipline. Initially, there were some conflicting messages about when to do, whether we needed to do OneFile, but those have been overcome now, and OneFile is a prerequisite for all HSSTs. And we had an excellent presentation from Stuart at the beginning. Now the course is established, describing OneFile and obviously how to use it, which is fantastic now for HSSTs to record their competencies. I would say that and echo the comments of the other trainees on today, that you really do have to maintain that work-life balance. That is really important. And it's important for HSST, but actually when you're a consultant clinical scientist, when you come out of the program, that's important, just as important as you know, when you're doing HSST. So you do have to wrestle some of your life back throughout the program, and when you finish, you have to keep that, because obviously that will keep you grounded. You know, my wife and children keep me grounded, and they keep me sane. And yeah, it's something that you really have to do, but you'll have to do that throughout your entire career. So top tips from me: work as a team. It's really important that, you know, as trainees, you work with your employer, you work with your clinical supervisor, your educational supervisors, to define what's the end goal. What do you want the consultant clinical scientist within your specialism to do at the end of this course? What are the main things? You know, for me, it's clinical advice, service development, and teaching and lecturing, just three very broad areas. But, you know, once you have a goal, once you have an idea of the responsibilities, you then have a point to work towards, okay? And you can obviously hang that on the curriculum and support that with the postgraduate diploma and the FRC PAP exams. But you really have to have a defined role. And it's really important, if it's a new consultant post, to have that role defined. And it will change as you, you know, progress in your career, because science changes, technology changes, you know, evidence changes. But you know, it's really important to have that defined between you and your employer, and work towards them as a team in order to work towards that end consultant role. As the others have said, you know, it's really important to look for opportunities and learn from others. Work with external bodies. You know, if you can work with your, you know, for me it would be the British Blood Transfusion Society, and I've also worked and done some work with the National School of Healthcare Science assessing STP students as well. You know, get involved in your profession, because that will enable you to meet other scientists in other disciplines, and to gain almost legitimacy within your discipline. I know for us, transfusion science is a very small, you know, it's a small family, and yeah, but like, if you're enthusiastic and like me, I enjoy what I do, I enjoy the science, I enjoy the discipline, you'll meet like-minded people, and yeah, you know, they are, you know, great contacts to have, and it's a really valuable experience to obviously network across organizations, but also across disciplines, because there's so much to learn from other disciplines in terms of processes which may be transferable into your own. Again, teaching and inspiring, I think that's a really good way to reinforce your own knowledge, teaching different people with different levels of knowledge, because they all ask different questions, as I've already said. But it also helps you to develop as a leader as well, and to gain that legitimacy, or that view as an expert within your field as well. You know, it's really important to teach, I feel, you know, and I would certainly recommend to your trainees teaching as one of the core pillars of their training, because they will be asked questions, and it's all right to say I don't know as well, and to obviously go and find out afterwards. HSST is a series of hurdles, okay? Don't look at the whole thing, and you know, Michael's eating how do you eat an elephant analogy is excellent, and that's exactly what it is, just one thing at a time, okay? Otherwise it is overbearing, okay? Do take time out to reflect and to reframe your goals, as Philippa has said. Have those regular meetings, because your pathway will change. You know, we've had a very disruptive 2 years, you know, if not longer, because of other things, you know, Brexit included, you know, all of the stresses of that, you know, on top of COVID. You know, it has been a very disruptive, you know, 5 years, I would say, and throughout that training program, you know, that will pull you in different directions professionally, trying to pull you away from your training program. So you will need to sit down at regular intervals and work out that training plan, and how do we stay on course? Do we need to make adjustments? Okay. Importantly, take time for you. Okay. Work-life balance is very important, and HSST can become all-encompassing at many stages, especially around exam times, as Philippa and Michael have said. But it is really important to take time for you and take time with your family and decompress, because you know, otherwise it can become overbearing, and it's not the be all and end all. And yeah, coronavirus has certainly brought home the importance of family and the importance of downtime, if nothing else. So here I am now, my virtual graduation ceremony picture. I've completed all of the requirements for HSST, and now I'm a consultant clinical scientist, something I never thought when I was delivering papers in East Sussex at the age of 12, 13, that I would ever become. The graduation has been delayed, but it will happen. So I will have an actual picture on my mantelpiece or somewhere in my house, but I'll make do with the virtual for now. So yeah, I'm happy to take any questions. I've also included my email address and my Twitter link there, and I'm more than happy to get emails from people and answer them if anyone has any questions about HSST or point people in the right direction. Okay, thank you.
Thank you very much, Tom, for that brilliant presentation. A question: do you feel that the HSST programme has been instrumental in helping you with your career progression to a consultant clinical scientist?
Yes, I do. I think it gave me the time and the framework. So the curriculum gave me the framework, the FRC PAP curriculum, of what I needed to know, but it was massive. It was very broad, okay? And obviously I knew parts of that very well. But it also gave me the time to look at what does a consultant in transfusion science look like, you know, a consultant clinical scientist. It's a new role. I would then look at consultant hematologists who work for the blood service. What are they doing? What sort of behaviours are they exhibiting? What kind of role are they providing in terms of clinical advice? But I'd also look at other people within the organisation, other leaders such as Catherine Howell, who was the chief nurse, an excellent example of a leader who, you know, who was an amazing, compassionate leader. And I would, you know, obviously you try and model people, you know, who exhibit leadership qualities that you admire. And I would highly recommend that. And having the chance to work alongside these people has been, you know, something that I wouldn't have had, I don't think, had I not undertaken HSST. So yeah, it certainly has enabled me to gain the skill set and the exposure to the individuals and the groups of people that you know, enable me to develop into a consultant clinical scientist. So
that's lovely. Thank you, Tom. Last question for you. Is your weekly predicted study day separate from attendance at workshops, regional study days, conferences? How many days are you allowed as study leave in a year?
Well, I would say that your weekly day is protected and it should be separate from conference attendance, because as a consultant clinical scientist, I attend conferences. And that will either be to speak at conferences, to talk about developments in the workplace, to talk about new guidelines. And I would consider that work, okay? To network with individuals and to learn, you know, obviously bring that learning back to my workplace and implement any kind of quality improvements that would translate over to my workplace, or any kind of improvements within or updates within treatment or guidelines. So I would see that as work and as separate to protected time, which is study time to maybe do your module A essays, practice for your FRC PAP exams. And obviously, as Michael has said, you can, if possible, build those up. But, you know, there are lots of conferences now, and there always were. So I think that does have to be balanced against actually service need. You know, certainly have your protected study time and some conferences, but, you know, attending all conferences and having your study time, I think, you know, if the service can't support that, then, you know, you obviously have to prioritize your study time, and then a couple of key conferences that are the key ones for your discipline, for your specialism, where most of the learning, you know, can be taken. So yeah, I'd say it's very important.